Hi, I'm Daisy,
Hi, I'm David.
and we're the MSA Crusaders. Hello, listeners. We're here today, MSA Crusaders, with Sassy Sarah. She's joining us today. We're glad to have you here, Sarah. How are you?
Hi, I'm good. Hi, Daisy. Hi, David.
Hi, Sassy, silly Sarah that has so many problems in southern Texas. I'm trying to get the S's on here. It's not working.
Yes, it's a tongue twister. Sassy Sarah. Silly, sarcastic, snarky.
I could believe the snarky part. Absolutely.
They got to sew you back together. That's what they do. Just need to take you apart
Yes.
and sew you back together.
Surgical Sarah.
I like that. Yeah.
Just
I'm gonna come up with
randomly,
something.
spontaneously combust Sarah. How
It's
about
fun.
that?
Very,
Still
very
got the
stupendous,
sassy in
Sarah.
there. Gotta have sassy.
Definitely sassy. Always sassy.
It is so good to have you back on the show, Sarah.
Thank you.
After she ditched us the last time.
Right?
I
She's what
know.
she would rather spend the time in the emergency room than hang out with us.
Right, I know. Us are the doctors, huh?
I have to go back and visit. I mean, if I'm not
Right.
there, they start to wonder, like, what's wrong with her? Where is she? Like,
Is
I
she
have to
getting
go back
healthy?
and be
No.
friends a little
Sarah
bit.
hasn't been here in a while. Let's go to her house and pick her up.
Well, actually, I think that time I went in
Angela,
ambulatory. I don't think the paramedics came that time. I
no, you
think
had to
that
go
was
by
just
ambulance.
mid-April, mid-May. Paramedics came and got me. But I think the other time, my husband drove me to the doctor, and the doctor sent me straight to the ER. I said, "This is what I get for leaving the house."
Isn't that
Uh,
like a nursery rhyme, like a little song for kids? Mama took me to the doctor. The doctor said no
no
more
more jumping
jumping.
on the bed.
Yeah.
No
Thank you,
more
sir.
monkeys jumping
Now
on.
we have this song in our head for the rest of the week. Good job.
Hey, Dr. Seuss, big S, little s. What begins with S? Silly Sammy Slick, six sodas and got sick, sick, sick.
I
Dr.
could
Seuss
not
is
do that.
he's been canceled.
I was a teacher for many years, and I have 3 children, and Dr. Seuss was my favorite.
These little seashells by the seashore with us there and there.
Oh, yes. Seashells and seashore. That's my style.
Right. So,
Sarah sells codeine by the seashore with. Okay, moving on.
we're going to talk about the gist today. David and Sarah, you already talk about some gists?
Yes, I have a great gist that we could talk about. He's my friend, my savior, the best person I know, mi amigo, and he is a mixologist.
David, you're cracking me up. I'm so glad we do this show. It keeps me on my toes.
Oh, not that gist. I'm sorry. My bad.
Come
Well,
on, let's be serious. Be serious with Sarah.
Sirius and Sarah in the same sentence?
Why not? Okay, let's start with you, David. What gist do you have on your list?
Oh
Oh,
Lord, that's
What
a.
gist do you have on your list?
I, I probably have the fewest, and I don't even know the gist names, but I mean, I see. I mean, I don't know
You
if
know the
PCPs
gist of the
count.
gist.
I
Neurologist,
call them the ologists.
ologist, yep, audiologist. Yeah, I probably only have 6 or 7, but the ENTs, the that's the big one. The ENTs, the bowels, the bladder gastroenterologist, the urologist, the who takes care of your orthostatic hypertension, um,
Cardiologist.
cardiologist, all of the neurologists, including mood disorder ones. Um, what else do you have on there besides the PCP? You have the I don't know if the physical therapist, the psychologist. I have a
Psychologist.
psychologist.
We all have one of those, don't we?
I hope so. With MSA, you're definitely going to
You
need it at some
have
point.
to. That is a gist that you need.
Yeah.
Yes, all of the ologists. If you start at the head and work your way down, that's how I try and remember all of my ologists. But when somebody says, "Do you see any specialists?" I'm like, Which
Do you have a
neurologist
minute?
do you want me to? I mean, I do have a list printed, but
let's hear it.
oh well, I don't have it printed right here.
Let's have
Oh,
it.
I carry it with me. Okay, so let's go.
Wait a
Let's
minute,
go from our
wait a
heads.
minute.
Neurologist.
Wait just a minute. Let's
Yes.
say Sarah for last because she's got the best. Okay.
Say what?
We'll save Sarah for last because you're the best.
Oh,
Whoa,
what
whoa,
allergies
whoa,
do you
whoa,
have?
whoa. We have standards here. Wait a second. Whoa.
Sarah's gonna beat us here. So we got
Yeah, which
neurologist,
neurologist?
psychologist,
I have a rheumatologist.
urologist,
Them. Yeah, urologist.
I had a rheumatologist, just have a pulmonologist and a gastroenterologist, and I said psychologist, didn't I?
Mm-hmm.
I think I hit them all. I'm supposed to have a gastroenterologist too.
Well, I'm actually pulling up my list here, see if I can find it in any
Sarah
any
is
kind of
prepared.
time.
She'll
But
get some for
let's
sure.
see. I have gastroenterologist. I have a neurogastro. I have an abdominal surgeon that I
Well, excuse me. That does not sound like a gist.
I was gonna say Sarah.
I don't know what
Did it just
Sur-
as you.
surgeonist. I don't know. I have colorectal. I don't know what
Yes.
her official, but she's a gistologist. She's for colorectal. Let's see. I have urologist, pulmonologist, cardiologist, EP cardiologist,
What's
immunologist. EP cardiologist, electrophysio. So like the rhythm of your heart, like rhythm.
Okay.
So like when I had SVT, really high heart rate, 213, 216 for 45
That's what it
minutes.
was you were going last time.
That's what happened. Oh,
Yeah,
AFib.
your blood pressure was way up there.
Oh yes. I was having AFib. That's what it was. So
Yes.
AFib also is with my EP cardiologist, but when my blood pressure is like 152 over 52,
It was in
and
200s, wasn't it?
there's a significant difference between the diastolic and systolic, and I can start to feel it. And I know I'm in AFib, and my Omron blood pressure monitor will catch it and prompt me to take an EKG on my cardia. And so that's always fun. But the EP cardio, he's done like the extended Holter tests where I wear like a monitor for 3 weeks, or one time I just wore it for a week. He did the ablation and the EP like study to see what was going on with my heart when I had the major episode of the SVT last summer. But otherwise I have general cardiologist too, and he's the one I see most of the time. Oh gosh, guys, now it got me off of rheumatology, neurology. I've seen neuro-ophthalmologist.
Yeah, there you go. I have a neuro-ophthalmologist. That's a great point, because MSA does two things. It tells your your eyes to stop blinking, which causes dry eyes, which hits double vision, or it causes your pupils not to focus. And I went there, and they were trying to eye drops for a long time, but then they did these tests that saw the circles. They put these strips in front of your eyes, and they're supposed to go left or right, and when they go the opposite direction, that tells you what type of television you have. So yeah, neuro-ophthalmologist is very, very interesting to have.
Where do you see those? I need to see one.
Where you get your normal eye vision appointments in for glasses, and normally they have someone that's trained there.
In San Antonio, there's only one, and I saw him when I actually close to the time of it was 2019. I saw him. And I guess if there's only one, I probably shouldn't say too much about it.
Yeah.
But let's just say that my local optometrist does a great job of continuing on with my care. And he has explained, just very simplistic, like you've got nerves and you've got muscles in the eye. And when things change, the muscles get weak, then your vision changes, and that's why
Look at that sassiness.
Sassy vision.
When literally, when I went to the neuro-ophthalmologist, I'm trying to explain, and he's like, so do you see double, like next to each other or on top of each other?
Right.
Or,
Mine's next to, yeah.
and I'm like, because at that exact moment, I wasn't having it. So it was, and anyways, so it was really nice to have just regular ophthalmologist. And he was like, yeah, like you have your eyeball and nerve goes there and a muscle goes there and big, and he just very basic. And it was like, well, and then he explained it perfectly. And he actually had done research. And so he knew, just from research what was going on. He didn't really need to have a fancy title to be able to help me, but I did see one neuro-ophthalmologist one time, but I see PT, OT, speech, respiratory therapy, palliative, PCP, of course.
These are not the GIST. These are just other ones.
Oh yeah, these are the ISTs. What other body part do I have? I don't have an ENT, David. I don't have an ENT.
I have an ENT.
No, you don't? I'm late to endo.
Endocrinologist, yeah.
Endocrinologist, nephrologist.
But going back to the eyes, I had a test done, and mine was 2 pictures. One was like a top part of a bottom part of a box, and the other one went this way. And my eyes saw them as one box.
Oh.
He goes, what do you see? I said, a box. He said, no. He goes, this is what it is. He showed me in the camera thing. And then he said, I'm going to give you prisms. So he gave me prisms, and my glasses are brown.
Yeah, prisms are the only way they can correct that vision if you do have the issue of double vision for MSA. Prisms are it.
Prisms take a lot to get used to.
Yeah.
What they
say
is,
not that bad yet.
They say put the glasses on right when you wake up. Don't look around without your glasses. Because it makes your eyes go. You get a bad headache.
I wonder how when you do that, have you tried it? Like, did it make a difference when you didn't do it?
It did. When I had the prisms on, I saw the picture of the bottom and the top lines, whatever how they were, and then I took them off and then went back to a box. I was like, wow, but that gave me a headache by seeing it corrected and not corrected. So they said, wear your glasses first thing you wake up. So don't look around, so that way your eyes don't unadjust and readjust.
Yeah, mine was the prisms did not work. And then when they brought these swabs, they look like paint swabs, like samples you get at like Menards or Home Depot or Lowe's or something for paint colors. And they put them against your eyes. And since my left eye was going the wrong way and my right eye was going the wrong way, the neuro-optometrist told me, he says, you have 2 types of double vision going on with your eye. And because of that, prisms could not fix it.
Wow.
So they said prisms would work, but it'd have to be a separate prism for each eye, which is not normal for what they for. In general, it's not a normal thing to do, and they don't know anyone who'll be able to cut the frames to the lenses to do that.
My lenses were so thick when I had my prisms.
Yeah, it's the weirdest thing. So I see 3. I know it's going to sound weird. I see 2 lines on either side of everything I see to left and right. So, but it's not
you see 3 heads? Do I have 3 heads?
No, I see 3 lines of heads, but sometimes you have 3 heads. Yeah.
Oh, you.
And they're spinning around.
Yeah. How many fingers do I have? Yeah. Well, that's how it is. So it's not that bad yet. So I still see like 20/20 with corrected vision. I still wear contacts. I have contacts my whole life. I got -7 over -5.5. My vision actually gets better as I get older, which is very surprising. But it's not that bad as to where I'm debilitated by the double vision. So I don't pursue it anymore.
2150 is my vision.
20 over 50?
2150.
I don't know if that's possible. I'm going to edit this out.
That's what my prescription said.
She's like, that's what my prescription says, David.
Well, that's your prescription. So your prescription and your what's it called? These Sarah, the you're correct. Your vision is just 20/20, or it could be 40/20. It could be 30/20. Right, but it has to be something 20.
Oh, yeah, 20/50.
20 over 50.
Yeah, that's what I was saying.
Yeah. Okay. That 50 is absolutely horrible.
Can be considered legally blind, they said.
Yeah. I was gonna say that 50 is outrageous. Is that corrected or uncorrected?
Uncorrected.
Okay. So vision helps it, or correction helps it.
Yep, that's why I have these bad boys at home.
Yeah. Those are the new Galileos. Oh man, check that out.
Bad
No.
boys, bad
Nice.
boys.
Galileo telescopes. Unbelievable. You guys missed that one.
You're so mean, David.
Squirrel. I don't wear glasses for a reason. They are thick. I went and spent one of my last disability checks on the nicest pair of glasses I can get, because I'm gonna need them at some point with my vision, right? Tommy Hilfiger glasses, and they are so thick. I've never wear them.
These are my grandma glasses.
Those are nice.
Actually, I'm wearing contacts right now, but because we're at such risk of infection, I have daily contacts, and I put them on. I can't feel the ends of my fingers sometimes, but I will wear gloves, medical gloves, to put the contact in my eye, because the glasses hurt. Like, just they're so heavy with my prescription. So I have a whole bunch of these cheap Dollar Tree readers, and they're in all different prescriptions, from like -2, or wait, this one says like +7, +1.75. Like, there's probably 6 different ones, and so it's just like, oh, what is it today? Like,
so you still put contacts in. I've noticed as my MSA's progressed, I can no longer open my eyes by myself long enough to put them
Oh, it's
in.
like, how y'all wear contacts?
Yeah. So now I did some yesterday. It's so hard to open the eye up to even get those in anymore.
Yeah, it's quite eventful, especially with the tremor.
Yeah, right.
Just poke your eyeball out.
So sometimes it doesn't really grow. And when I put eye drops in, because I have to put eye drops in before I put the contacts in, because my eyes are so dry. Yeah. And they're like those blink contacts. But I'll just like lay back and I'll just well, I don't even know where I'm putting them in, but I'll just like blink, 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 and like drop the liquid in my eye and like let them soak.
Hope it hits the eye.
Then, well, it'll hit my eye somewhere.
And I think that's the most important thing also about the tremors and trying to do fine motor skills, like what you fine motor movement, like you're talking about. Like for me, for my contacts here, like there's a mirror in front of me that I have to put my elbows on the table so that they're not tremoring crazy. Yeah, because if you don't have that, it's almost impossible. Sarah knows with contacts.
What about dryness?
We have poked our eyes 1,000 times.
Well, what about dryness? Aren't your eyes really dry?
Yeah. Oh yeah, I have dry eyes. I have Srogens. Tested positive last summer for Srogens, which goes with MSA apparently. Testing out with but I have dry eyes. But I use those eye drops, and I use them before I put my contacts in, and I have dailies. So like if they fall out, they fall out.
Even if I had dailies, I would use a whole bottle a day. I was putting the eye drops in like every 30 minutes.
I was going to say they're over there. They're extra. They have contacts that are extra hydrating. Those are the ones that I have.
Yeah.
But I still have to put them in throughout the day. Like I just drop. Yep.
I can't wear them. There's no way. First of all, I couldn't put it in my eye.
One day I can be moist.
And the second, I couldn't keep my eye lubricated enough. So I had 2 things against me. I was trying to poke my eye out, like they say in the Christmas story. You're going to shoot your eye out.
No, and if it happens, you just wait for it to calm down, and you just, sometimes it takes a while.
If I was trying to do something, I shake. So there's no way I could do it. I couldn't. My husband, forget it. I can't have him do it.
The hard part about contacts in MSA is when you have contacts in, and they're, because I don't use dailies per se. I use
How do y'all take them out? Yeah.
weeklies one too. But having them where your eye is already dry, bone dry with the contact, and trying to get that out, it's like rubbing sandpaper. It is, because you can wet it from the outside, but it's not going to get under the contacts like right away. It takes a long time. Yeah,
how do you get them out without it hurting?
You go like this.
Yeah, you swipe that side. You swipe left.
You just literally, like, I will wet them, so at least, and I won't touch my eye just because of the risk of infection. Like, I can't, and that's why I wear the dailies, because I can't. But I will put the eye drops on, and if I sleep with them overnight, oh my gosh,
just pop your eyelid back and forth.
Yeah, if I have a syncope at night and I don't have time, like, I was like, shoot. Yeah, I once had somebody say to me, well, how do you know you have syncopes? I thought you're supposed to sleep at night. Like, that's the thing. I'm like, if I fall asleep and my contacts are in my eyeballs and I'm not hooked up to my dextrose and my BiPAP isn't on, like, I had a syncope. Like, I didn't just fall asleep at random. So yeah, it's adventuresome, but I am bound and determined to wear contacts as much as I can. There are days where I have to wear my glasses, but it's something that I just really feel strongly about.
I had to retire from the contacts. I'm sorry. I can't calm down when I'm trying to do something. I say harder, and then trying to put the contact in, and I'll be like, I could never stop. This on me, and I couldn't do it.
Cutting toenails is like it. Yeah, I refuse to give up my peripheral vision until the day I die. I will die with contacts. I gotta have my waking up, middle of the night emergency. Of course, my eyes are so swollen dry anyway that takes me a minute to wake up. But I gotta have the peripheral vision for driving, for doing anything. I refuse to give up on that.
Yeah, it is hard at night to have to get up and not be able to see, and like, have to go to the bathroom real fast or do something like that's when the falls happen.
Trying to do something fast.
And without midodrine.
I will say I didn't get to go swimming this week because of my catheter, but last week when I went swimming, I got in the pool, was at the therapist, and that's usually not what I do. But he had to finish up with another patient. So I was in the pool. My husband goes, "Go ahead and start walking. It's okay." So I start walking, and then the therapist comes and start running to the steps. It's like, "Stop running!" And I like to fell in the water.
Are you sure your husband is not up to something there, telling you to go ahead and start walking?
No, David.
Something my wife would say, "Yeah, go ahead, David. It's only a hurricane out there on the beach.
Faster.
Okay." Yeah, right.
Run like Forrest.
Run, Forrest.
Oh, that's hysterical.
Oh.
I missed swim therapy this week though, because I had my catheter changed Monday, and I have had nothing but problems all week. You would think of having a year of a suprapubic catheter would be much easier, but no.
No.
That's miserable. I'm so sorry.
I know, it just started flaring back up.
Well, so let's take this a little bit. Let's go a little bit different spin on this. So Daisy, knowing what you know now, a year plus onto it, if you had to go back and do it again for someone else, and let's say, would you change anything that you've done with the catheter?
No, I would still get one.
Okay. I mean, I think that's the biggest issue. We all sit here and talk a lot of crap, especially Sarah, for God's sake. But we all sit here and you hear us complaining about stuff. But would we go back and change things if we could? And most of the time, the answers are no. But I might try, like Sarah, like a different doctor or something else. But I would still do the same procedure.
Yeah, I don't really think we're complaining, David. I think we're just telling it like it is.
Yeah, that's the truth.
It's our reality.
That's the truth and nothing but the truth.
So help us, God.
It kind of sounds. Some people may say we're complaining. Come on now. I think we're just telling her. I did have somebody recently ask me about my stoma, like if I could go back and would I still? And I said absolutely. I love having my stoma. Not that I really even had a choice.
Can you say that again? I'm missing what you're saying.
For I
You're,
had
you're
somebody ask a stoma for a
Stoma.
stool.
What's this?
though.
I got you.
Stomach
Okay.
is like your
Yep.
site. It's like your site for the catheter.
So it's kind of
Oh,
like
okay.
how Daisy has it for bladder. I have one for stool. So like I had a
Gotcha.
total colectomy, an end ileostomy in 2021 for complete colonic inertia. And so there was no way that I mean, I did have a choice. I had
Yeah.
to have my colon out and have the stoma, but and it can't be reversed because I don't have
Colon.
pelvic floor function. So I mean,
Right.
even if it's an ileostomy, but it's not to be. I mean, there's no way to reverse it. But you know what? It is like I would not change anything about it. I am so happy with it. If I never have to sit constipated on the toilet for 50 minutes again, and like it is just something that is. I mean,
See, I had that freedom not having to sit on the pot to go pee.
yeah. See, like
Never.
look at these positives. We're saving time by not.
Exactly.
True.
And I may
Yeah,
be joining the ear club soon too, so I'll have a Sonic brown bag and a golden purse.
yeah. Yeah. I'm like, I don't know how far down the pathway I am with Sarah with
Brown bag special.
the colon part of it, but yeah, when I had those tests sent up to the Mayo, and they put the balloons in you to see your pelvic floor function, like how much you can push, and
Yeah.
none. I was arguing with the doctors, like, there's no balloon in me. Like, what are you talking? Like,
You can't feel it.
Exactly. Couldn't feel it at all.
Nope.
Right? Could have pushed anything. Like, not even a
All those
smidgen.
nerves they're gone.
Well,
Yeah. So we're getting
I
that.
was so scared that because I was like, well, so what do you do? And they're like, well, we put gel up in you and you're going to have this base here. And it was during an MRI. It was like MRI with topography. And
Yep.
maybe I said that wrong, but and we're going to put gel in you and you're going to, this is great for the podcast.
Yes.
Listeners
This is
want to know.
This is not a crappy story. Let me tell you.
Here we go. Listeners want to know.
This is the real shit.
You might say our listeners have the urgency to hear you. Yeah.
Or not the urgency.
I'm
wait.
Go ahead.
Lack thereof.
Go ahead, Sarah. Go ahead.
You have to wait and see. So they're like, yeah, we'll put this gel up in you, and what you're gonna do is you're just gonna bear down as hard as you can.
Mhm.
And like I'm thinking, oh my God, there's gonna be a huge mess. Number one, not a damn thing came out.
Yeah, me too.
And like,
Number two, you couldn't push the damn thing out.
and I was like, but I had already done something called the Sitz Maker test, and you swallow like it's basically the size of like a big vitamin, and it has 24 rings in it. And they take an X-ray, and then you swallow it, and they see after 5 days how many rings are left, and that tells the function of your GI system, right? So I had 24 out of 24 rings left after 5 days. I had complete colonic inertia. And so surgery was right there. And I was on, as the doctor wrote in notes, a slew of carcinogenics. I was on like lactulose twice a day. I'm just drinking it from the bottle. I was on Linzess 290. I was on
That's
many
what
things.
I'm on now.
And could not. And so I had a total robotic total colectomy with endoileostomy, and my stoma's name is Zed.
Well, okay. So what you're saying here, for the record, Sarah, on our podcast, is that whoa? What you're saying, for the record, is that Taco Bell does not affect you, and you have no complaints with Taco Bell.
I don't know because I live in South Texas. Do you think my friends are gonna let me eat a fake Mexican restaurant?
I saw a TikTok video the other day. This girl was pregnant, and this guy, she would not poop for like a week. And her boyfriend said, "We're gonna try 3 things." They tried something. Alexa didn't work. They tried Taco Bell. It worked.
It never makes me have issues. I love Taco Bell. It's truly authentic. I promise you. It's very good.
He said, "You're down to determine 100% gonna have a BM tonight." As soon as we come out of the bathroom, he goes, well, she goes, yes.
But last month in May, which I think I was a no-show in May for you, I was dealing with intussusception intestine for the third time in 2 years, where my intestines folded into themselves, which now remember, my large intestine is gone. So I have small intestines still, but they fold into each other, called intussusception. And then I had small bowel volvulus, which is a partial bowel obstruction. So I had emergency surgery last month, and it was like, okay, something's got to move in there, like, but it wasn't really.
So that bulb function, I have that partially, but very mild right now. But the fold, the ring fold collapsing, I had at the very top of my large intestine. I have that as well. Not horrible right now. Still an issue, but yeah, those two things I have you just spoke about. So I'm saying, like I'm coming down that pathway of Sarah.
You're just like you're running right after me, right, David? You're like chasing. Well, we just found out that we're the same age almost. I mean, you're a little bit younger than me, but we're almost the same age.
I'm a very young 44.
I'm ahead of y'all on the age, but I'm running right behind you on the other.
I'm 45.
Y'all are so young to be going through this. Really?
I told her she looks like 36. I promise you, it's clean 36 too.
Yeah, right. You know, my favorite comments are: patient looks chronically and critically ill, or chronically and critically ill appearing, and I'm like, come on.
That's all you got? Yeah. I love if you
ever for that, but why do you have to say I look like it, guys?
Right.
If you ever go to specialists, especially God forbid you have MSA or any version of neurodegenerative disorders, look at the scaling models they give you when they test you. And this is a doctor looking at you. They always rate you for, it could be 1 to 4 or 1 to 21, 1 to 7, whatever. Go into your charts. Just don't look at this. Don't look at just the summaries, but look at the actual the entire details of the visits.
No.
What they tell you to your face is vastly different than what they actually put on the paper.
Oh yeah.
I don't have numbers. I looked through mine. I couldn't find no numbers.
So most specialists will do these tests for that you get these scales and the numbers with the scales, but most neuro doctors don't. Neurologists would do that. PCPs typically don't do that type of stuff.
But
because
specialists.
Yeah, because what's it called, Sarah? MSR.
UMARS, yeah.
A whole bunch of those
United
scales.
Movement, yes.
Yeah.
But what you have to ask for is, number one, not just your portal, but you have to ask for the visit summary and the progress note. And then you have to fill, because the progress note has more information. The visit note is just basically like, I mean, it's nothing. But I have requested my full records from the hospital, and from 4 hospital stays, I got a 4,000 pages on a CD, and I learned a lot about myself on that, because those are the things. But no, they don't tell you anything of the doctor. I mean,
I got all my records from UAMS, and I read through all the notes. I mean, that was like 180 something pages. There wasn't none of the UM SARS in it.
So the doctors have to be actually actively doing the tests. So, subconsciously, or, they have to actually be doing it. Like,
but when doctors all have done it?
You know what? Well, actually, I have it right here, because I just had, my PT was here today. It's a unified MSA rating scale.
Right. Yeah. But there's different, so to Stacey's point, there's different scales for different doctors for different tests. Right. And they're not going to tell you they're doing a scale on you ever, that they're doing that type of scaling test. Yeah. You just go by, like Sarah says, I get all my information from I'm glad she said that, from the progress notes in whatever portal you're using, whether it's my chart or whatever.
Clinical trials.
Go back in and go to documents and view all of it, because, and you know what, the only way to know and be an advocate for yourself, and get me off my pedestal because I will go forever. The only way to know what is going on with your health is to read what is going on with your health, to read
Yes.
the insurance company notes, to read what the doctors are saying, to request the full records, to actually view the imaging instead of just the imaging report. Because the imaging reports are so generic and they're looking for an acute finding, and sometimes it's not going to show up as an acute, but there's still a problem there.
I'm glad you're saying this, Sarah, but
So
I,
there's so many.
I've read some of the, the imaging reports, like you said, they're so generic.
Mhm.
But the clinical trials, have you noticed how they say, must be at 1 UAMS,
Mhm.
UMS, SARS or
Mhm.
whatever. But that's why I looked for the stuff, because right now Colorado OMNO 2808 is looking at my reports. They said they have everything except for the MRI.
Your brain MRI? Didn't you have
Yeah.
one?
Yeah. I said, well, I have that. I can mail that to you myself. But
Yeah.
And see, that's what we have to do as patients, is we literally
Yep.
have to, like, I have a fax on my phone. I have eFax app. And when my brain cells start working together, I will get on, fill out a release of information, and fill it out between the doctor that needs it and the doctor that has it, or like, the imaging
yeah.
center, and have them sent. Because I'm like, I don't want you to just read the report. I
Yeah.
want you to look at it. And I had one doctor one time tell me, I'm going to leave that to the radiologists. I'm like, excuse me?
What kind of
So,
doctor are you? What
so
MDF name?
that doctor is not good at reading film, is what he's telling you.
Exactly.
Basically, that's what he was saying. Yes. He's like, I'm just going to leave that to that. Well, how about if you view it? Even just last month in the hospital, the report said it could be this or it could be that. Well, the surgeon came in and said it is clearly
Yeah.
what
Yeah.
they said it could possibly be. And like your intestines, we see them inside of each other, and usually we don't catch them on, it happens to kids that are 0 to 3, which I cannot imagine a little baby going through that amount of pain and all of that. But they said, usually it's clinical, like it's the type of pain, it's the type of whatever, but we see your intestines kaleidoscoped inside of each other on imaging. Like, but that was the doctor that was doing the surgery. But the radiologist who read them, great, to their credit, hey, we found what it could be, but they didn't know.
Well,
But thankfully, I have a solid team that looked at the imaging.
so you also got to be very clear that with what you said, okay, all the notes, the right doctors reading them. I think the most important thing for, especially those with MSA or what might be MSA or some very significant disease or disorder, is what institution are you going to? Because not all MRIs are created the same. Not all machines are created the same. And there's so many. Like I went to Mayo and they said we got to redo these tests because the ones you had the imaging are very subpar. With my local doctors, but when you go to like I said, the academic universities, they have usually the best of the best, including the Mayo Clinic and things like that. So like you talk about University of Texas, whatever, the universities have some of the best equipment ever. So it's important that, like you said, I got a lot of doctors say, well, it looks like you might have minimal changes here, but we can't be certain because the testing, the machines that tested you are very, not high end. So we have to repeat it. They repeat it, and you're like, oh, well, you further progressed to what you thought.
I'll be glad to have the skin biopsy in August and see that report. I won't get the results back for 3 weeks, it says. But August 6th, I have the test. And by the way, changing the subject just a second. My physical therapist just called, and she's coming over to do some dry needling tomorrow.
Oh, wow.
I've been looking forward to that for about 3 weeks now.
Well, I hope that it is better than what it sounds.
Surely it helped my neck until I got a Botox.
Oh, okay.
They have their dry needling, and I have my dry vodka needling. Dry martini. Hey, if you can do your I can do my ings, okay?
Have either one of y'all
I'm glowing.
have either one of y'all had dry needling?
No.
Not my cup of tea. Cup of tea.
I
think
have major sensory issues from,
Yes.
from Guillain-Barré. And so that Guillain-Barré, just to be clear, like didn't leave.
Mhm.
MSA just came on. Like
took over.
they start getting, well, like the symptoms are, there's overlap, yes, but like I still have major nerve damage. I can't put my feet into water. Like
Yeah.
it is painful. Air touching my just regular air touching my skin on my legs. It's called adenoidheda, an abnormal response to normal stimuli, like sends me through the roof. So when I put my feet in water, I have socks on. Like
Yeah.
my skin just reacts, besides turning all of the colors, and it really can't handle it.
And you said your head can't either, right?
No. It is the part, like when my back is about the only place that can handle water going on it. But there's other ways to take showers. So
You two, or I don't know, Sarah, you might experience this some, but
I think about this.
do you ever experience? Because I can't roll over. I'm asleep on my back. I sit on my butt. My butt hurts so bad all the time now. And I get up like every hour and a half or 2 hours and get some blood pumping in through my buttocks. But still, it hurts so bad, y'all. I want to cry. It hurts so bad. Do y'all experience that?
I have pain in my low back. Like I have chronic low back pain, but I don't have like bed sore. I don't have anything like that. I have had difficulty at times when, in treatment fluctuation related with weakness and not being able to roll over in bed or not being able to move. But I showed you the ladder rope,
Yeah.
rope ladder. I have a
My
side
problem
board.
is that I have the catheter.
Yeah.
So it's hard to lay on your side. My hip goes to sleep anyway. But
You don't have to lay on your side, but just like my stoma, I don't know if you can see, like right here is where my stoma is. And so I can position myself. This is the pillow that I was telling you about. This helps me keep my pelvis up so that it doesn't fall down into the bedding that's soft. So this kind of this is my sunshine. Don't take my sunshine away, David.
I was going for more of a scrambled egg, but okay, sunshine it is. Yes.
My husband says scrambled egg every day, and he's like, "Oh, sunny side up," and he calls it my egg, but it's my sunshine. What is it?
So that kind of we got
The yolk's on you.
elevates your pelvic area.
Yes, it elevates this pillow elevates my pelvis, and so it's easier. It also helps like if you're with tapping and stuff, so when your organs fall back, it tilts them up.
I can't have caffeine either. Dang it.
I have I'm like showing you all this stuff on my bed. It's like it's like a physical therapist's office. But this is like a knee tight pillow, and I can put it right here. And this helps with the positioning for my stoma. So I'm not laying on my stoma. I don't roll on it. Nothing hits it. And I have these 4 beautiful, you see they're beach. They're beach. And they're in here. And so put them in here, take them out at night. And
This looks like little throw pillows.
And they're like little throw pillow covers, but they hold like my braces and my
Yeah, you were showing me that. Showed me yesterday. Here, she has like a carpal tunnel brace.
Oh yeah,
wears on one arm. I have to wear that too because it keeps my hands from being so stiff. David,
this one.
You need to take that out. That's really helpful on the hands, David.
This one is really good at night, but it was messing up my watch, and my watch is a medical one, so it like tracks my oxygen and vitals and stuff. So, but this one, I just wear it on my right hand now.
For the listeners, it looks like it's just a little orthopedic brace.
It looks like an ankle, like when you sprained an ankle or something. Yeah.
And
I
it has
sprained
a
your wrist.
cushion in here, but it's the brand is Ace. I got it just on Amazon, and it really helps with the joint pain and the drop wrist, and keeping my
Your
arm in
fingers.
line. So
And show him your phone. I said, I've got to do this to my phone.
I said, Jamesy, you will understand.
Seriously.
Okay, just yes, you'll understand too. So, dropping everything and trying to hold on to anything, even though it doesn't weigh anything. So this is like my actually my dear friend Maria got these for me.
Phones get heavy after a time, though.
Yeah.
There's a lot of cases that have them. Yeah, what you're saying.
I stick my fingers in here and it can hold my phone.
And for listeners, again, it's just like a little handle on the back of her phone. And she has a lanyard that goes on her pulse ox. She's on there.
This is a lanyard for
that's
my
her traveling phone, David. That's her traveling phone.
But sometimes I can't, like, I drop it, or I just can't hit it, and sometimes I can't it doesn't pick up my phone, like my finger, the sensation of my fingers. So I have a stylus, and I just clip the stylus onto this little part right here. And yes, it's part of what goes in my travel bag.
So she travels from the couch to the bed, or the bed to the couch.
Yes.
But seriously, Sarah, she gives you some great tips. She really does. And a new perspective on MSA.
Well, we have a choice, I think, like how we have a choice over what we feel, how we can make our days. I tell my kids in the way of like, you can step left or you can step right. And this applies to their life. This applies, I think, to everybody. But, I tell my kids, like, every day you're stepping forward, right? You're stepping either left or right. If you don't like what happened when you stepped right, then step left. Like, you don't have to wait until tomorrow. You don't have to wait till Monday or the beginning of the month, the beginning of the next year for a New Year's resolution. Like, you have all of these times during the day that you can choose
to make the best.
How you feel. And it doesn't mean that you have to choose to be toxic positive. You can be genuinely positive. You can feel the feels. You can cry. You can scream. You can do whatever, but you don't have to live there.
And Sarah has become my second therapist, by the way. Oh, my bad. As I pick up the phone and call her, Sarah, how do you do it?
It's hard. I mean, I'm not saying like MSA causes, it's a brain disease, right? We have emotional times. Our brains don't function. People think we sound fine or that we're whatever fine, but inside we're like, no, it's
a hot mess.
Like, I'm not remembering what happened and what until I look at my phone and I see, like, there's a
word. I get that a lot now. I hate it. I know the word till I need to talk about it, but when I get some time to talk about it, it's like, that word, the word. The word that's in my brain, it won't come out, that word.
Or ask me on the spot something, and I'm just like,
all frozen.
Yes, but I know it. It's just my brain won't retrieve it in time. And I try, like, that's one of the things in speech therapy, like, hey, Sarah, answer a direct question. Because my brain wants to go all the way around, and I don't realize it always until, and then I'm like, did I answer the question or did I just talk? Like, I'm not meaning to be tangential or I'm not whatever, but it happens.
Did I say that in my head or did I say it out loud?
Yeah.
I have diarrhea of the mouth a lot.
I curse and pray, and that is one of my biggest saviors of sanity, is cursing and praying and just
curse some more.
And if somebody doesn't understand it, then it's not for them to understand.
I guess from a caregiver's to be grateful for my caregivers. I don't have diarrhea the other way.
Unbelievable. I
Right?
don't know. I
What is
was
that?
gonna,
Linseus, what's the name of that medicine?
Linzess.
It's supposed to be opioid constipation reliever. It ain't working on me yet, but they said it might take a week for the first time.
Oh, I've never heard of it as that. Just as constipation. They may have used it like that way for insurance purposes to get it covered because insurance denies it a lot of times.
I didn't even have to get a pre-authorization for this time.
That's awesome.
I know, right? But I was on lactulose, and it wasn't pretty good. But he wanted to try Linzess and see how that works.
Yeah, I just started drinking the lactulose from the bottle as I was losing my colon. I was just like, I'm not even measuring, and it was so disgusting. It's like that green stuff, right? Like
yes,
thought,
tastes like NyQuil, doesn't it?
Today I was taking my liquid fish oil, and I asked my mom. I said, "Hey, do you want some?" And she's like, "Is it good?" And I was like, "Yeah." And she's like, "Your face says otherwise."
yeah, as good as fish oil could ever be, right?
Sarah, what was it you showed me yesterday? She takes it's like a dojo, strawberry, banana, mango. It's got
Strawberry banana.
electrolytes in it. Is that what you said?
No, I think you're talking about her margarita.
We wish, don't we, Sarah?
Yes, there's that funny thing about I keep trying to make protein shakes, but this is how they're turning out as a margarita. But are you talking about my drops, my electrolyte drops?
The dojo, the squeezing like yogurts.
Oh, the go-go. Oh, yes. So it's like the
applesauce kind of.
Yeah, let me see if I have one here. So this is my lunch box that my family packs for me, and it has my foods for
our goodies
time period in it, and
her goodie bag.
I have a smoothie and I have yogurt. Somehow I have high cholesterol.
That looked like suspiciously close to a bottle of vodka, Sarah. Can you show us up? Okay,
it says no good on the top of it, doesn't it?
Okay. Just making sure. Okay.
Too good. See, I changed the seal for them so they don't know.
Looks like a flash to me. Okay.
What's really in that bottle, Sarah?
Well, are you gonna edit this part out? No, I'm just teasing. It's really Too Good yogurt smoothie with 70 calories, 2 grams of fat, 5 carbohydrates, 3 sugars, but 10 protein.
Speaking of carbohydrates, me and Sarah both were talking about cholesterol yesterday. We both have high cholesterol. She's like, how can she have cholesterol high? Because she uses dextrose and she doesn't eat very much carbs. She's like, how's my cholesterol high? I'm like, me too. And they're both about the same, weren't they?
Yeah, our levels are about the same. It was very interesting. I haven't had a regular diet since the end of August because of my chewing difficulties, swallowing. I'm on a special macros diet. Very few carbs and sugar anyways, even before I had non-diabetic hypoglycemia. But
dextrose she has 24/7, so
and I have I flow dextrose 24/7, 365 days a year.
Which means, Sarah, if we check the bottle again, it may not exactly be what you're saying is in the bottle. Okay.
So what kind of alcohol causes it? Because I might as well start then.
Vodka.
Vodka causes high cholesterol?
Got a lot of carbs in it.
Oh,
Sarah, you've been lying to us.
I have a dietitian. She would be so disappointed. That's another one I didn't mention. I have a wonderful dietitian.
We want to talk about these?
Slobber cloths? Yeah. Otherwise known as a chamois for your truck, but it was a chamois for the mouth. Yes, drooling. Yeah.
Drool rag.
Yeah.
I didn't get Botox in my mouth this time. It didn't work. She did prescribe me some drops. They're regularly like eye drops, you guys, but you put them under your tongue and they stop you from drooling.
Atropine,
Gee,
glycoporolate.
there you go. Sarah's
Wow.
a medical encyclopedia, I'm telling you.
Sarah is our sponsored therapist slash everything is for MSA Crusaders, by the way.
So I was like, I don't know. Let me call Sarah and ask her.
I swear, I collect information and I learn so much every time I'm in the hospital. And we are a family of rare diseases. We are a zebra
Even with
family.
MSA.
And so, you know, why not MSA too? So actually, no, I don't take it. I don't, that's one symptom I don't have. But I am familiar with the medicines for it. And sometimes they use ipratropium bromide spray for medication-induced excessive salivation, salivia. So atropine drops can be sublingual. Oh, David, you're laughing at
She literally said celery. I'm thinking of celery. I'm so sorry,
I had
Sarah.
to get a prior authorization for those drops.
I'm like, celery. I have not raised my salary in many years at work. Unbelievable.
I did not have to get a prior authorization for Linzess, but I did for those drops.
Oh, of course. Why not? It's just ridiculous too, because they're like, and probably because you're using them for something different. That's what they're doing.
Yeah.
So all the doctor needs to do is write it for how it's authorized, and then it goes through and then just tells you like, hey, don't put them in your eye, put them under your tongue.
Oh.
Yeah. I probably have had to do about 15 prior authorizations this year.
It's ridiculous. Like I said earlier, you have to know you have to know the rules of the game to play the game, and the game is life, and the goal is to stay alive. And insurance sometimes just you have to and advocating for yourself, and that's another reason for getting your records and knowing what's going on, because I don't know. I don't know that there's another way. And I don't know it all, but if I will find this stuff and I will bring it to somebody and say, here, this is what I know. This is what I can find out. This is the research that I have found. I didn't open Dr. Google, but here's the papers. Here's this. Now, here's my lab results. Here's my imaging. Can you put it together? Because I can tell you until I'm blue in the face about what's going on, what my symptoms are, all of this, but I need help putting it together. And that's what I try and ask of providers, because I mean, I've had to educate myself and learn from others to be able to have this knowledge.
David, I think you might be on something.
I usually am, Daisy.
I'm changing the subject. There's a squirrel running around. I need to catch it. But you know how you said if you're touching something when you go to sleep, you dream.
Oh yeah, it's a trigger. It's part of your dream, and it's not good. Punching and stuff. Yeah.
Twice this week. Okay, first night I tried to sleep different, so I put a pillow under my right leg. I dreamed I was climbing a fence.
Yeah, I'm telling you, you're gonna stop doing this stuff.
And then another night I had my remote on my trapeze bar, put my remote for the bed, and I was holding the cord and I was ringing the dinner bell.
Yeah, I'm telling you, anything you have. I mean, I was climbing a fence, trying to break through a fence like a military movie.
Really?
And I had some wires on my hand, but in my brain, I'm trying to break through a fence. It's just it triggers stuff in the brain.
It does. It's crazy. I like.
And what's even crazier, like I just went to an airport recently, and I was daydreaming as we're walking through a long airport, daydreaming just about nothing, right? Not that anything in front of me triggered it. Separate daydreaming while we're walking this long pathway, and my hands come up to start to slap somebody because in my daydreaming, I'm actually annoyed at this one person back at home, and I'm slapping this person. So remember when you go to sleep in REM, in sleep, your body is, for the most part, 99.9% paralyzed, where it doesn't act out dreams. And the vice versa is when you're awake, you start to perform these physical movements and actions that your mind, daydreaming or anything about anything else, is thinking that you're not supposed to act out. You do the same thing during the day.
Oh no, what did you do, David?
I'm telling you, when your hands come like you're trying to backstop somebody, you at the middle of the airport walking, you notice these things. You're like, what in the world? So yeah, it's just not nighttime, but it will start in the daytime too.
You're gonna have to put your hands in your pockets while you're going through the airport, just so you can just be nice.
I was doing this one time really, and then in my mind, I was daydreaming about turning the faucet off.
Yeah. I'm telling you, it's crazy how the brain works in such mysterious and still some unknown ways. But that dopamine is there to control all these things, and when you don't have it,
you don't have no control.
Yeah, it's funny to me. It's hysterical. Yeah,
that makes sense. But my husband bought me a pause for the dinner bill. What do I have for dinner?
Nothing. Yeah, even better. So Sarah said one thing that I definitely want to double down on, as far as, I think this was before we started recording. She says she's fired many of doctors before, many of medical professionals, right? Yeah. And I think that's the most important thing. People with MSA feel distraught for many reasons. And let's not talk about death, because that's obviously there and whatever, and then how it's going to go. We all know how it's going to go. But people feel distraught and hopeless, and, put in an adjective, because of MSA, because of what's going to happen. But a lot of that is preventable if you just simply do your job. Like Sarah talks about calling the insurance companies. I have a medication, which I'm not going to say, that is almost life and death to me for MSA.
Is it vodka?
That too. That's number two. That's number two.
You tried to get a prior off on that, didn't you?
On an IV of full vodka, absolutely. Morphine too. And we called them because they kept denying it like 7-8 times in a row. And I called them. I said, before we start, I start yelling at you because you represent the insurance company. I said, what diagnosis do you have me down as? They did not have the MSA diagnosis, even though it's been on everywhere else. They did not have it. The insurance company did not have G98 points, whatever, G90.3, whatever it was. I can't remember.
96. I can't remember.
Such a project. I got to look it up again. But they did not have the diagnosis code or diagnosis term itself. So when I told them that this is, literally, I said, this medicine is life and death for a person with a terminal disease, and you're going to kill me the hard way by not filling this medication on time, but keep getting pre-authorizations. Let me tell you, Sarah and Daisy, they did a complete 180, approved it while we're still on the phone. As my Walmart went ding, the pharmacy, I was like, well, that's interesting. But they approved it right away because they did not know. So there's a lot of things we can prevent, like we could prevent staying at a doctor that is subpar. That's not benefiting us. That's not helping us. That's not complimenting us with what we need. And we can also get to the insurance companies and actually make sure we're on the same page that this is MSA. Do you not know what that is and what I have? Because the nurses from the insurance companies will call me asking, what the hell is MSA? I find it amazing that MSA is so rare. The nurses that overview your referrals from medication procedures will call you and say, what is this MSA and what does it do? We don't know what this is. So sometimes we have to be, like you said, like Daisy said, an advocate for ourselves, even to the insurance companies.
It's like I told you, my palliative doctor came and he said, what am I training for? I said, MSA.
Yeah.
Oh, okay. I've done this before. I said, oh, you know what MSA is? He goes, yeah, ain't that atrophy of the muscles? I'm like, no.
Yeah.
You don't know what this is. So my husband goes in the other room and gets all kinds of pamphlets for it.
You got one word, yeah.
So one of the codes that show up for me, the G9, I'm trying to think of what it is. You got me thinking now, David, and it's going to bother me until I figure it out. But it's basically multiple system degeneration of the autonomic nervous system.
Yes.
So when I say that to another doctor, that makes more sense to them than when I say multiple systems atrophy.
And when you walk into that doctor, right? I've done this at least a dozen times without exaggerating. They said, "What is the issue? What do you have?" I said G90.3. Go to, and I'm telling you, sir, they pivot back to the computer, type in G90.3, and they say multiple degeneration central nervous system, and they know, like they, not that they did not believe you before, but if you have a medical code, billing code,
Yeah.
it's like you are now king, and they believe everything you're going to say thereafter.
Where do you get your code?
Sometimes, but then
Diagnosis.
don't go toe to toe with the doctor that has the
Right.
God complex, because if you say something that the doctor doesn't know, and then they're just, I mean, you're gonna get
Dumbass.
nowhere.
Yeah.
Because I mean, my sister's like, can you just go in and like, she said, go in, don't get dressed, like, you know, just don't talk, just just lay there, because sometimes you're just not going to get help, because I'm talking to them and I'm telling them, you know, about my diagnosis or what is going on, because they're like, what do you mean you don't have a fever?
Right.
And they have no clue.
You know, so it's like sometimes it really helps to have that information, and there are a lot of people that appreciate it, and those are the ones that I say they called me an advocate. The ones that call me a bitch are the ones who don't want to hear that, and they
Yes.
don't want to hear
They don't
it,
want to think you're
or-
smarter than them.
right. And it's like, hey, this isn't an intelligence contest. I'm not asking you to understand the like, how could you totally
I'm
know
not
that?
trying to hurt
I'm
your
asking
pride.
you to listen to it. Right. Like, it's not a pride thing. I just want you to listen and understand, like, instead of just making something up like, oh, here, I think we'll give you an antibiotic today and you'll be good to go. Like,